Hi, everyone. I'm Mark Giampa. I'm with the Crossroads Baptist Church here in Pelham, New Hampshire. I'm not a pastor. I'm the business manager for the church. So they don't let me handle any of the spiritual stuff. I handle all the business stuff. So part of the challenge that we had was we recently expanded our kindergarten program. And went right through from kindergarten 1 to K through 12. So we have a full middle school and high school. We have about 200 students, and because of that, we had to add about 8 more teachers, and then also we had to add more staff to the actual church staff. And our healthcare costs just went through the roof. And the biggest challenge that we had was not being able to budget for the increases. We were getting quarterly increases that were anywhere between 10 to 15%, and just wasn't sustainable. And we were looking at our options of possibly talking to our staff members and our teachers and rescinding the healthcare benefit that we were giving them, because it was just crippling the church. And Mark Fournier and Allison Fournier, they approached me with Impact, and we knew about MediShare, and we didn't really like that program because, like you had said, Jeff, Impact pays first to the provider. With MediShare and some of the other programs that are available, the patient would have to pay up front and then go and try to get reimbursed. And that wasn't something that we were interested in doing. And so we went through the process. We got a quote, and we were able to save about $10,000 a month on our healthcare costs by be able just to switch over to Impact. And the other thing was we're offering a hybrid solution, because some of our staff members have pre-existing conditions that wouldn't be eligible. So they stayed with Harvard Pilgrim, which was the provider that we currently have. And so with that hybrid solution, we're able to provide healthcare and reduce our cost by about $120,000 to the church. So that was a big, for us, it's a game changer.
Well, Mark, I really appreciate you sharing that story. $120,000 back in, and I know you were talking about with costs rising, you guys didn't know like what was going to happen with the school, and this potentially, I think you mentioned, might have even possibly saved what you guys were doing with the school.
I mean, we were looking at all kinds of options, and what we're also able to do, Jeff, is with all of our members prior to us switching to Impact, they also had to pay and contribute to the program. So we were paying and they were paying. Because we had this tremendous savings, we actually pay all of their costs. So they're just responsible for the deductible, but the church now can pay for their monthly responsibility. So we essentially gave them a raise by saving all of this money. So they normally would pay $500 a month. Now we say, look, put away your deductible, that's your responsibility, but we'll pay your monthly costs. And then essentially they get a raise with that. So, for us, again, it's compounding benefits for us.